Hello everyone, this is Mac here, and I welcome you all to my YouTube channel, which is called Mac Vlogs. Wow, what a topic we have chosen today. Why? Basically, because a lot of people are going through this issue of kidney stones, kidney diseases, and how we can prevent from getting these things in our body. Like because of COVID, lots of people have been facing kidney issues, kidney infection issues. So I have got down an expert, the Dr. Muhammad Ali, all the way from USA, Atlanta, Georgia. He is an expert and he's a kidney specialist. So all the people out there who have all the questions related to their medical history, related to the kidneys, and whatever the problems you have gone through in your life. So I think you have the right doctor in front of me today to ask the questions so that we can find the solutions and we can help our people, our Pakistani people, or the all types of people around the world who needs cure for this infection of kidney. Okay, and kidney is an important part of a human body. So let's not waste our time and let's invite and welcome my guest, Mr. Muhammad Ali, the doctor from Atlanta, Georgia. Good evening, Doc. How are you?
Good afternoon over here, Mac. Thank you so much. I'm doing well. How are you doing?
I think you're already dressed up, so I think my kidneys are in danger to be being operated by a very expert from
Yeah,
US.
no operations today. I'm off. It's all good. Waiting for your vlog. So thank you so much for having me over.
Amazing. Okay, so who is Dr. Muhammad Ali and what is he doing in USA? As I might have given a little short brief to my audience, but we would like to hear from you, and then we're going to take it forward on this very important topic so that people can find solutions for their medical history of kidney related diseases. Please go ahead and give your introduction.
Mac, thank you so much. I'm Dr. Ali. It's been a long journey for me. I came to the US maybe I would say back in 2005, 2006, around that time. I'm a graduate of medical university in Pakistan, and I came all the way. Always had this hope and dream to, sort of achieve something here in the U.S. And by the grace of the, man up there, things went very well. So, initially, I got here, I did some research, and then got into a residency program where, you go through those many years of training, and then practice as an internal medicine physician, where we take care of adult patients, with a lot of, comorbid medical issues like diabetes, hypertension, to say the least, and then, kidney failure, heart failure, pneumonias, and a whole lot of other array of things, diseases, should I say. Then I sort of moved from Minnesota. I initially was in Minnesota, then I moved to Atlanta, Georgia, back in 2015. And then I was an attending physician here at one of the esteemed universities and assistant professor of medicine as well. I taught the medical students. I, sort of wanted to do a whole lot on that aspect of that as well. And then went on and did my nephrology fellowship, which is, equivalent to a specialization, as you would say, in Pakistan. I did it over here, but I'm just saying, that's the equivalent, what you would do, back home. And now I'm here. I take care of kidney diseases, kidney ailments. I take care of patients who have chronic kidney diseases, which means, they've been suffering with a whole lot of medical issues pertaining to the kidneys. And I also do dialysis and, things of that nature, where the kidneys are gone and then, they come to us and, we try to help them out. So that's a, sort of a little background, not little, but, still a little bit more than little. So that's, what I love to do and, what I thrive on. And, I thank God every day for what I do.
So I guess for the last 1.5 years since we have been facing this COVID pandemic and all, so you might be very busy basically because all the doctors from different organs are been working out with with the aged people who have these diseases, and I'm sure the kidney has been affected the most in during this COVID and pandemic. Do you agree with that?
100%, Mac, and I'm glad you brought up this point. As you know, and you're very well aware, and you've gone through with some of your family members, unfortunately, as well. And my, you know, uh, sort of condolences to you as well, or, on your father as well. who suffer from COVID. Yeah, COVID has actually taken over the whole world, as we know that. It's a bad pandemic, which never happened. But now that we're in this pandemic, it's been tough. Life has been tough. But we've been taking one day, 1 hour, every second at a time. I don't know. U.S. has been probably been hit by the fourth wave, I would say, with the Delta variant, and now there are all sorts of different variants coming along the way as well as. So it's tough. One, to save someone else's life, and two, of course, keep yourself healthy and save your life as well, because I have two little girls as well, and of course a wife coming back home, uh, from work, and making sure that we don't bring all those things back home as well. um, Thanks to science and the vaccination as well. And I do sort of take this forum and opportunity for me to sort of vocalize this as well, that the vaccines do a really good job, especially the Pfizer and the Moderna here in the US, and trying to prevent serious hospitalizations from COVID. So coming back to the point of kidneys and COVID, COVID can affect the kidneys with different ways, different reasons for that as well. um, Typically, the consultations which we get in the ICU are from multi-organ failure, where the kidneys are failing as well, and we've actually sort of identified the virus in the urine as well of patients, such patients. So it's not that we know that COVID can affect multiple organs, including the heart as well, causing congestive heart failure, strokes, blood clots. So it's a sort of a multi-organ disease for me, the way I treat it and the way I look at it. But you're right, a lot of patients dying from not only kidney failure, dialysis. Of course, we try to help them, but eventually they give out because of XYZ reasons, because they've been just so sick. So this pandemic has definitely taken toll, not only on the people sitting on the other end of the seat, but also from the first line perspective, like myself. So
Usually, why does this happen? Like the kidney stones and the kidney infection. What are the areas that the people don't really focus on, and then it affects them with these kidney stones or these diseases? So, like, is there any age group, or is there any precautions which they don't take, and it happen, or it can happen to anyone? Please
so kidney
highlight some
diseases.
areas on that.
Right. Thank you so much, Matt, for touching base on that as well. So, kidney diseases, there's a whole array of kidney diseases, as I'm sure people are aware of that. But the kidneys are very sensitive organs, for multiple reasons.
Mhm.
20 to 25% of the body's blood flow goes through the kidney every minute. So you can imagine the kidneys are filtering. They're the filters of the body. It's amazing how God has created these little two organs like bean shaped. They're actually two in the back. Their job is actually to clean the blood. So whatever we see in the urine is all the dirty stuff which is coming out.
Mhm.
Kidneys are very smart organs, and we should talk to the people who are suffering from kidney disease and don't have that. They know the importance more than we do, because we just go to bed, we wake up in the morning, and then we go to the bathroom, and here we are, the kidney is working. So there are different ways we can divide the kidney diseases. One is a structural kidney disease. Those could be genetic as well, where cysts in the kidneys, and a father or a mother can pass on to their offspring. So that's one way. The second way, with the most common way, is the number one cause of chronic kidney disease and kidney failure is diabetes, followed by
Is what?
hypertension. Diabetes,
Okay, diabetes.
diabetes,
Oh,
right, right,
okay.
right. Yeah, so the number one cause of kidney ailment or chronic kidney disease, which means kidney disease which has been there for more than 3 months, to define the
Mhm.
word chronic. All right. So and then there are acute kidney diseases which happen in the hospital, where there's an infection elsewhere in the body, and the kidneys are not able to keep up with that. So diabetes is one of the things which I wanted to sort of focus a little bit more here, where the diabetes can affect the eyes. They can develop retinopathy. There's a condition. The number one cause of blindness, even in the US, is actually diabetes. All right. It can affect the heart, the kidneys. It can affect the blood vessels, the nerves, all sorts of
Mhm.
different things. Then comes hypertension, high blood pressure. That's a silent killer. The reason why we say the
What
silent
about
killer is
what role does the high blood pressure has the effect on the kidneys? Does that also involves in having
right.
kidney failure?
That is correct. So high blood pressure, we call it hypertension, right? So
Uh,
hypertension or high blood pressure, the way you said exactly, it can actually go and damage the little arteries inside the kidneys, because the kidneys are very small structures. So the way God has made them, there's these little arteries which wrap around the kidneys and go inside the kidneys. So those arteries can get slowly damaged, over time, and those can actually cause the kidney function to decrease. The way we check for a
Mm-hmm.
kidney function test, there's a blood test. It's called creatinine, Creatinine, or this is the easily available test. You can actually go somewhere in Southeast Asia, request a doctor, or in the US or in the UK, wherever, and they're very well aware of that. So that creatinine number, and there's another number called BUN, but for most part, that creatinine number sort of helps define if somebody has chronic kidney disease or acute kidney disease, or if there's any kidney damage going on as well. So
Mm-hmm.
that's just one test to start off with.
I
There's
see.
another test which we can do. We check the urine and we look for protein or blood in the urine. The patient may not be able to see the blood, but we see it under the microscope. So these are some of the things, which I thought I could touch base as well, where sort of have a little bit more, education on that, where people
Mm,
could be aware that, oh,
I see.
because, people, if they're urinating fine, if they're peeing fine, they think that they don't have any kidney problems. But that does not equate with kidney disease.
How much is it important for the water intake? Like we drink water, right? So that is directly engaged with the kidneys. That's related to the kidneys, the water intake. So what would you prescribe the people who have kidney issues or who don't have kidney issues? How much the water intake should be taken? Because the body keeps on sweating and like because of the dryness, a lot of people don't drink water on time and they don't know how much water they should be taking their body requires for the kidney to function properly. Please highlight that as well.
That's a great question, Max. So this is a question which all my patients would ask me in the outpatient clinic, especially. So, in the US, the way we approach this is, especially I'm going to break it down for people with different disease conditions. So people who
Hmm.
have kidney stones, and I'm going to touch base on that more, how do we form stones and what can we do for the stones as well. People who already suffer from kidney stones, they have a very good high chance that they're going to develop another stone in their lifetime, or, within the next year or two. And then those kidney stone pain is very bad. It's sort of equates to a childbirth pain. So that's one of the worst pains known to mankind.
I
So
see.
we recommend to drink at least enough water, enough water. And in the US, the way I tell them is 80 to 100 ounces, which is a whole lot, which is probably like 10 to 12 glasses of those 8-ounce glasses or 10-ounce glasses, back home over there. Um, so we let them, sort of, just drown in water. Too much water is also bad for you because that can decrease your sodium levels. And that's another sort of concept, which a lot of people have to be aware of as well. But a lot of water for especially patients who have kidney disease, especially with kidney stones. The second thing is, as the
Yeah.
kidneys start failing down or fail on us, there are 5 stages. Typically, we do recommend that, go ahead and hydrate as much as you can if you have chronic kidney disease stage 3, up until stage
Mhm.
3. But 4 and 5, I'm not just sure if we would allow them to drink a whole lot of water, because that can actually be detrimental to them. Because if they do start drinking a lot of water, if the kidneys are not working fine, they can start retaining that water. In fact, we start giving them pills to make them urinate called diuretics. All right.
I see.
People with congestive heart failure, we try to restrict their water. So there's no right answer to this. Everyone is sort of, more specialized in their own way, where, we would give a different sort of an advice to a patient with chronic kidney disease versus somebody who's healthy. Now, if you definitely live in an environment which is hot and humid, go ahead and hydrate as much as you can. That's always good, because you don't want to get dehydrated, right? But for most part, you should be drinking enough water, especially in hot and humid climates.
Hmm. So, which age group patients uh, come to you and the most, and what type of difficulties they face in finding the solutions from their kidney issues? Which age group
So the age group, which I take care of, is
come to
18
you?
plus.
The adults, okay. Are you there?
Yes, I'm here. I think you were breaking a little bit on me.
Don't worry, he's going to be back. Just a few minutes. Don't worry, everyone. You know, all these live sessions do have these technical issues because of the weather, the long distance, the internet, so we have to bear all these things. So I'm sure he's going to be back again, and we're going to continue our live session talking about an interesting topic, which is called kidney diseases and the preventions and all. He's back. Yes, Doc, can you hear me? Are you there?
Yes, I can hear you very well. Yes,
Yeah, sorry
Matt,
for the
thank you so
interruption.
much.
I think because of the technical issues of being the long distance, we just missed you up, but
No
never
worries.
mind. So, my question was the last time, which I was asking about, that what age group of patients, uh, try to connect with you in terms of finding solutions for their issues? Do you have any particular age group of patients?
Right. So I typically take care of the adult patients, 18 plus, the way we define it here in the US, and I'm sure, back home as well over there. But for most part, my patients are 50 plus. I take care of a lot of elderly patients, in their, the way we say geriatric population. So for most of them, I'll be honest with you, they're in the 70s and 80s and 90s, very sick patients with a lot of medical issues, with heart failure, kidney failure, strokes, diabetes. I take care of a lot of complicated patients, right? Um,
I see.
yeah, that's the sort of a patient population, but again, anywhere between 18 to, 18 plus is, my area of expertise, right?
Well, a lot of people are looking into this interesting topic. They want to understand exactly why the kidney infections and kidney diseases and kidney stones happen to normal human beings, and what areas and what ways they can prevent this from happening in their family or within themselves. So it's a really great to have you, Doc. So I
Thank
think it's very informative for people to understand how to take, like, how we look after ourselves. So we really need to look after our organs from inside. We don't know what's happening inside ourselves, whether it's heart, how it's functioning, the kidneys, the lungs. We don't know exactly basically what's happening inside us until and unless the doctors like you who can guide us, in a way that what steps we should take to take care of our health, how we need to be fit, and what type of a diet plan we need to take care of us. That's really important. So first of all, a big thank you for being part of MacBlock's family and to educate and give us the awareness about the kidneys, which you are the specialist about.
thank you so much, Matt, for having me. I appreciate it. Absolutely.
It's an honor. It's an honor, definitely, basically, because for the last 1.5 years, which we all are facing this COVID, and a lot of people have lost their loved ones. So I feel that it's a responsibility of each and every one of us to help our loved ones so that we can help them in any way they are facing issues, the problems, the diseases, and the infections. I know it's important. You being a health worker, being the front line, helping all the people out there in the hospital, in the US, and around the world through your advices. So I'm sure that we really need doctors like you in our society who can help us and guide us why we need to take care of ourselves. Because in this speedy world, we forget to take care of ourselves. Am I right in saying that?
100%, Mac, and thank you so much, for bringing, this sort of a forum on this platform where, we can share this and sort of elaborate on this. So kidney awareness, most people would not be aware of kidney disease the way you said until unless the kidneys are pretty much, of course, completely gone.
Mhm.
So it's always important to get an yearly physical examination done by the physician. So this way, we can actually be up to date on, different vaccinations, your healthcare concerns, and so on and so forth. Two, as I said, some of these kidney diseases do not have symptoms until later in their lifetime, where, the kidney disease has advanced to the point that, we're not able to take care of the body or the kidney, should I say.
Doc, there's a question. You can continue, but I'm
Please
just
go ahead.
putting a question on the screen for you by Mr. Fazal Ahmed. For you, you can answer that once you finish your thing. He wants to know. My question is to Dr. Ali, how to prevent kidney stones. So you can
Excellent question.
definitely answer him.
Let's talk about that as well. Yeah, so you
Yeah.
you know once you are seeing a internal medicine physician or family medicine, do a yearly physical, do yearly labs, check your cholesterol, check, make sure you don't have diabetes, make sure the thyroid function and the kidney test and all of that looking good. So that sort of helps you identify this earlier. Some of the signs of kidney diseases is swelling in the legs, would be one of the things which you got to be aware of. You get short of breath, you don't have any energy, you get very fatigued, very tired, just lethargic all the day long. And then in advanced kidney failure, people can have the shakes in their, hands. They can get very drowsy, sleepy, confused. They're throwing up all the time. They're not able to eat. So some of the signs, I thought, but again, I don't want you to take this as sort of written in stone, because a lot of these symptoms could be overlapping with a lot of other medical issues as well. So best to consult with your physician. Coming to Mr. Ahmed, that thank you so much. That's an excellent question. I wanted to take this opportunity, with your forum here, Mac, and sort of define these kidney stones and how they form. So the urine has more than almost 3,000 different minerals and all the substrates and the toxic products and everything which are going out in the
Uh-huh.
urine. When there's an imbalance on these minerals, that's where you start forming the kidney stones. They start to crystallize and they form into a sort of a stone-like structure. The most common form, 80%, is called calcium oxalate stones. All right. Then comes, calcium phosphate, uric acid, strew white from infections, and so on and so forth. So first of all, to Mr. Ahmed, it's always important, if you do pass a stone or anyone else in the family, who's had it, the first thing you got to do is make sure you collect the stone, you strain that urine, you collect it, and you provide it to a nephrologist or a urologist. All right. We go through the stone analysis and we figure out what kind of a stone it is. As I said, calcium oxalate stone is the most common form of stone. The first and foremost thing where you can prevent the stones is drinking lots of water, especially if you've had a stone before. We like to drink enough water where we can generate 2.5 liters of urine. So, Mac, for you, if I ask you to drink maybe 10 glasses of water, you may make 3 liters. Contrary to me, I may need 12 glasses of water to make that much of urine. So, everybody would be different. So, it's not the amount of water, it's the amount of urine you got to generate. So, 2.5 liters. I know it's hard to measure urine, but you'll get an idea. And you'll be honest with you, at times I give them these jugs, and they should ask them, to urinate in that, and then just make sure you do that. And a lot of my patients actually are doing that. All right.
I
The
see.
second thing to prevent kidney stones, as I said, the calcium oxalate, you want to not reduce your calcium intake from the diet. You got to make it moderate, which means you eat a serving of two of yogurt, non-fat, sort of here in the US, and I'm sure back home as well, there's a lot of sugar added to the yogurt. So no sugar added to the yogurt, just plain yogurt. 2-3 servings of that yogurt will help you prevent those kidney stones as well. Don't take extra calcium in the form of pills, because that will be counterproductive. We don't want you to take elemental calcium in the form of pills, but we really want you to increase your dietary calcium, and that'll bind the oxalate in the gut, and you're gonna poop it out in the feces. All right. So that's one of the things. So a lot of water, some yogurt. Then there's also some genetic diseases where there's citrate stones which are passed on to the family, and those are not treated easily. There's a lot of medications as well, which you can try and help the patients with the kidney stones as well. But those medications will only be given, like hydrochlorothiazide or potassium citrate, based on your stone analysis and your urine analysis. So that I'm not gonna, sort of advise on that. But your water is your best bet. You have to make 2.5 liters of urine every single day.
Mhm.
That's sort of in a nutshell.
How long does it take for the kidney stones surgery, which people go for to remove the stones from their kidney? How long is the process?
That's a great question. So there are sort of three big areas, or three kinds of procedures we do here in the US.
Hmm.
One of them actually depends on the size of the stone. If the stone size is less than zero point 0.5, millimeters, there's a good chance, it's a flip of a coin for me, 50-50 chance that you can pass this stone on your own. There's some medications which you can give you, some pain medications as well to help you pass the stone, some medications to help dilate that ureter, which comes out from the kidneys, and then you can pass the stone hopefully. If the stone is big enough, typically more than zero point 0.8 or 1 centimeter or 2 centimeters, then there's a procedure where you go through the urethra from down below, go all the way into the kidney, laser fragment those stones, and leave a stent inside the kidney. Those procedures can last anywhere between 30 minutes to an hour, not too long, even less than that. It's the preparation which takes a little bit longer.
I see.
There's another, procedure where we can do in the back of the kidney, go in, take the stone out. And then, there are different things, one can sort of, but these are the big ones, where, we can do, it's called ureteroscopy. And the other one in the back is a little bit more complex procedure because it requires a little bit cut in the back. So,
I see.
typically 1 hour, at the most, but no more than that. Right.
When we hear about the kidney failure, so a lot of age people or any age group, we have seen that they go for the dialysis as well, right? So how difficult and how tough it is on a patient to go on for dialysis when they have a kidney failure.
So dialysis patients, and that's one of the reasons why I love, to take care of the kidneys and the patients, who have chronic kidney disease and end stage kidney disease where they would require dialysis. It's very tough. It's tough on the body. It's tough on different organs, especially the heart. They have to typically dialyze like 3 times a week. At times, it's even more than that. Anywhere between 3 to 4 hours. Some people may be more, some people may be less, depending on their weight, depending on how nicely we've been dialyzing them, and so on and so forth. The different ways we can dialyze someone. There's hemodialysis. Hemo means blood. And then there's peritoneal dialysis, where we can actually make a little sort of cut and put a little catheter inside the belly. The peritoneal dialysis patients can stay at home. They don't have to leave their home, and we can dialyze them every night. It's pretty streamlined. It's easy. It's not that tough. You just have to be careful of a few things so you don't develop any infections in the gut. And the hemodialysis patients, then they need access where we can actually, the vascular surgeons actually, what they do is, they join the vein and the artery and they make a fistula, and that fistula is connected to the machine through a needle. So, yes, so coming back to your question, it's not easy on the body. But the good news is this is the only organ where we can actually have a pretty normal life, which has failed with the help of dialysis. There's hardly any other organ where we can actually keep them alive, with the help of a machine for long. But some of my patients in the dialysis center, they've been dialyzing for 17 years, 20 years. So it's a life-saving procedure, but it can cause issues as well in terms of anemia, in terms of phosphorus levels, in terms of a lot of other calcium levels in the body. So dialysis actually can sort of help maintain those levels. With kidney failure, all electrolytes go out of whack, unfortunately. So, but you're right. It's not something which is very easy for the patients to do this 3 times a week for the rest of their lives.
So what positive message you have for all the kidney patients around the world, and what precautions they should take in terms of their kidney issues. So what is the message from a doctor, the specialist out there, to all the kidney patients so that they can have some sort of belief and relief by hearing from you that message so that they can come and connect with you for their solutions?
Thank you so much, Matt, first of all, for giving me this platform. The message is that there's has to be a whole lot of other awareness, because millions and millions of people here in the United States. I just cannot give you any figure back home. I should be able to, but here in the United States are suffering from kidney diseases. So go to yearly physicals, get your levels checked, get your creatinine levels checked, see if you have any kidney disease in the family. If you do, there's a high chance you could have it. If you see any blood in the urine, if you see foaming of the urine, when you urinate, you see a lot of bubbles, that's a bad sign. That means you're leaking a lot of protein in the urine. If the smell of the urine is bad, if you're hurting, those are some of the symptoms. So go seek medical attention sooner than later. But from your platform, I'd definitely like to sort of let them know, or share this sort of give the message to everyone that please take a look at the urine, the color of the urine. If it's getting too dark, if you're not urinating all that much, if you have to drink a lot of water to make the same amount of urine which you were doing before, these might mean some signs of kidney damage or kidney failure. Because as I said, the kidney failure may come really late, and it could be all silent going on for those many years, but we have to catch it on time for the kidneys not to fail in the future. And God bless, stay healthy, for everyone out there, and especially you, Mac. Thank you.
Thank you, Dr. Ali, for adding value by sharing your experiences and sharing what the people out there who has kidney issues and kidney who problems they might be hearing you, and I'm sure I'm going to be sharing all your messages and this video with them so that they can start connecting with you to find the solutions where they might have seen lots and lots of doctors around the world. So I think you are a very humble, very great, caring doctor, which I find you. So I feel that everyone should connect with you for the solutions. So thank you so much for being part of MacLogs this evening and sharing your experience because you are the expert in kidneys and as the kidney specialist. Thank you so much for being part of
Thank
MacBooks.
you so much, Mac. And just a last note on this, where it's a sort of collaborate efforts. I couldn't do anything without my nursing staff. I love my residents, my students. I teach them to teach me back. We learn from each other. So learning goes on for the rest of your life. I hope I've been expert, but I appreciate you. I'm very, very, very kind of you to say that. Thank you.
Thank you once again. So everyone out there who ever know that within their family, friends who is suffering from kidney issues, kidney diseases, kidney stones. So I think, and I would definitely endorse and recommend Dr. Muhammad Ali sitting in Atlanta, Georgia, to connect with him for all your problems so that he can go through your medical history, the reports to understand and give you solutions so that you can come out fresh and be healthy again.
Happy to
So
give advice.
thank you so much, Dr. Ali, once again. So before you proceed, we will MacBlogs would like to say a very big, 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 big thank you. And we would like a small shout out from you to all my audience by saying so that I can connect them with you. So that coming from you, a shout out saying if you like MacBlogs or if anyone like MacBlogs, please become part of this journey. Please go ahead if you'd like to say something.
Thank you so much, Mac, for giving me this opportunity. I've known Mac for some time now. Not only is a great entrepreneur, he's a great, sort of YouTube personality, but at the same time, a great human being. Let me tell you guys that as well. Just very genuinely nice, very kind-hearted. He helps lots of people back home as well, the poor, the needy, children, all of us. So thank you so much for creating, this platform where Mac, everybody is connecting with you. And I definitely, if you please like him, and I genuinely say that you will be not be missing out on, a whole lot if you will be missing out if you don't subscribe to his channel. So please go ahead and subscribe to Mac Vlogs, and then stay tuned for a lot of different ways where he can connect different business personalities, media, social issues, a whole lot of different platforms. So please go ahead and subscribe to Mac Vlogs as well, all my friends. And Mac, thank you again. God bless you and God bless your family.
Thank you so much once again, Dr. Ali. I'm so blessed to have you being part of
Like,
MacBlock's family from this evening onwards. And we will look forward in having you again on a different topic, which through your experience can be shared and we can find solutions for the people out there. So
appreciate it,
everyone
man. I'm
out
happy
there
to advise.
who haven't yet subscribed MacBlocks yet, so just a humble request, if you really like me, if you really like my content, if you really like the personalities I'm bringing on MacBlogs for you to bring change, to add value. So please do subscribe, share, and like, and keep supporting this channel because this channel is not only meant to be for me, it is for all the people out there who we can connect with. Thank you so much once again. God bless you, little angel. Your daddy is doing an excellent job. Take care.
Thank you so much. Bye bye. Thank you.
You're welcome. Take care. And I wish everyone out there a good evening. Take care of your families, everybody. And I'm going to be back again with another guest of mine, another content, another topic to enjoy with you all. God bless you all. Take care. Good evening.